Welcome to Thrive with Pride from Age Options, an online space for LGBT older adults and those who care for them. This is a recording of a live event held on Zoom, which included a lively Q&A, which we did not record. Amy Cunningham, research coordinator at the University of Washington, joined us to talk about dementia and aging in the LGBT community and discuss the Aging with Pride IDEA study, the first federally funded study looking at these issues specifically in the LGBT community. If you or someone you may know may be interested in participating, please see the contact information for the study listed below in the video description. After you watch, please fill out a very short survey to help us improve our online programming. It is anonymous and will take you less than 5 minutes. The link to the survey is also in the video description below.
Great. Good morning once again, and welcome to Thrive with Pride. This is a monthly event from Age Options, a program supporting LGBT older adults and those who care for them. Today, I am delighted to introduce our guest presenter, Amy Cunningham. Amy has been a research coordinator at the University of Washington, in both Washington State, I should say, in both the School of Nursing and Social Work for 25 years. She has coordinated over 20 studies in the School of Nursing's Northwest Research Group on Aging. And these studies have explored behavioral interventions designed to assist older adults with a multitude of issues, from insomnia, osteoarthritis pain, menopause, caregiving, to memory loss and dementia. Her current position is with the School of Social Work's Aging with Pride IDEA project, which seeks to help older adults with memory loss and their care partners in the LGBT community. So Amy, whenever you are ready, take it away.
Great, thank you. So let me confirm, are you able to see my slides, Kate?
Yes, I am, and I can hear and see you well.
Wonderful. Okay. Well, thank you so much for inviting me to be with you, and thanks for spending some time with me this morning to learn more about this. We're going to be talking about Aging with Pride IDEA. IDEA stands for Innovations in Dementia, Empowerment, and Action. It's a research study being done out of the University of Washington, and the principal investigators are Karen Fredrickson Goldson in the School of Social Work and Linda Terry in the School of Nursing. And this study is funded by a grant from the National Institute on Aging, which is part of the National Institutes of Health. Aging with Pride IDEA is the first federally funded research study examining ways to improve health and quality of life for adults aged 50 and older with memory problems and their caregivers in the LGBTQ+ community. So first, I'm going to tell you a little bit about dementia and caregiving in the LGBTQ community, and then I'm going to talk about specifically what Aging with Pride IDEA is doing to address that. Some people say, why study this community? Well, there's a rapid growth of LGBTQ+ older adults with Alzheimer's disease and related dementias. LGBTQ+ older adults have higher rates of social isolation. They're less likely to be married or have children and more likely to live alone. They have higher rates of some chronic conditions and risk factors for dementia, including depression, cardiovascular disease, smoking, and social isolation. They're often medically underserved, stigmatized, and vulnerable, and there's a lack of efficacious research-based interventions for this group. We know a lot about LGBTQ+ individuals as they age from another study being done by Karen Fredrickson Goldson. That's a longitudinal study called Aging with Pride, National Health, Aging, and Sexuality Gender Study, or NHAS. That's the first federally funded longitudinal national project examining the health and well-being of midlife and older LGBTQ+ adults. Longitudinal means it's been going on for a number of years. It's surveying over 2,400 LGBTQ+ adults between the ages of 50 and 100, and it's been going on for 10 years and is ongoing. And results from this study really have informed why and how we're doing the Aging with Pride IDEA study. LGBTQ plus older adults are a growing population. It's estimated that there are 2.7 million adults aged 50 and older who self-identify as LGBTQ plus in the US. 1.1 million are 65 and older. By the year 2060, the number of LGBTQ plus older adults will exceed 5 million. And 10% of LGBTQ plus older adults report severe or extreme cognitive difficulties. 38% report moderate cognitive difficulties in at least one area, and 77% report mild cognitive difficulties in at least one area. And when we talk about cognitive difficulties, we're talking about when a person has trouble remembering, learning new things, concentrating, or making decisions that affect everyday life. There are health disparities among LGBTQ older adults compared to heterosexual older adults. Lesbian, gay, and bisexual older adults have higher rates of disability and mental distress compared to heterosexual older adults. Lesbian and bisexual women have higher rates of cardiovascular disease and obesity than heterosexual older women. And gay and bisexual older men are more likely to experience poor physical health, to live alone, compared to heterosexual older men. And this article here on the right is one of the many, many articles that have come out of the NHAS study that Karen Fredrickson-Goldson and her research team have been doing. There's many published articles that have come out talking about the health disparities in the LGBTQ population. Other study findings: 13% of LGBTQ plus older adults report that they have been denied health care or received inferior care. More than 20% do not disclose their sexual or gender identity to their physicians. Almost 2/3 have been victimized 3 or more times. And 59% report they lack companionship, 53% feel isolated from others, and 53% feel left out. So they really are an isolated group in general. LGBTQ plus adults as caregivers. They become caregivers at a higher rate than the general population. 35% are caregiving to a spouse or a partner, 32% to a friend, 16% to a parent, and 7% to another relative. And caregivers in the LGBTQ community are more likely than non-caregivers to report a disability, depression, victimization, and verbal and physical abuse. Who are the caregivers? Many LGBTQ plus older adults may not have a relationship with their legal or biological families and are instead supported by their families of choice. They're twice as likely to age without a spouse or partner and 3 or 4 times less likely to have children. About 2/3 of dementia caregivers in the US are women, but in LGBTQ plus communities, both men and women have a high likelihood of caregiving. And LGBTQ plus caregivers often have limited legal power and can be excluded from decisions regarding where the person they care for will reside or what health care they will receive. And then there's different issues among LGBTQ plus older adults with dementia. Many have hidden their sexual or gender identities for much of their lives, and memory loss can introduce challenges surrounding how they manage their identity and the extent that they reveal or conceal that identity as their memory loss progresses. And this statement is a perfect example of that. I'm over 50. A trans health activist afraid that my insistence on being who I am confuses people. I'm afraid of dementia and Alzheimer's. What if I go back to my 10 or 20-year-old self as a girl or woman? So all of these factors together are what has led Karen Fredrickson-Goldson and her team to come up with the IDEA study. Studies show that LGBTQ+ older adults with memory loss and their care partners are understudied populations, and our project is designed to aid in the development of much needed interventions for vulnerable midlife and older adult populations. So let's talk about the IDEA study. The IDEA study is based upon proven treatment. The foundation of the program is an evidence-based program called Reducing Disability in Alzheimer's Disease. That's a study that was done by Linda Terry, who's an investigator on this study. It was done at the University of Washington in the School of Nursing, and it was done in the general population, so folks with memory loss and their caregivers. And that study had some pretty amazing findings. When people had the intervention that the RDAD study provided, it was shown to reduce institutionalization in the person with memory loss, so they were able to stay in their own home in the community longer. It reduced stress for the person with memory loss and their caregiver, and it increased physical activity in both the person with memory loss and their caregiver. So IDEA is taking that same intervention and adding an enhanced component that addresses the unique risks, strengths, and resilience in the LGBTQ+ community. So we've had to make some adaptations. Previous to the COVID pandemic, we were doing the intervention in folks' homes. We sent a coach into their homes and they delivered the intervention or the coaching sessions. When the pandemic came along and we had to socially isolate, we took the program and we transitioned it to one that could be done virtually. So now all of the coaching sessions are done virtually using DoxyMe, a very easy to use telemedicine platform. All session handouts and materials are sent by mail or email. If the person with memory loss and their caregiver do not live together, we can still include them as long as they each have a device and can connect with us in their own residences. And we can provide a tablet with connectivity if needed. We didn't want to exclude people who don't have a way to connect with us. So if they need a tablet and connection to the internet, we can send that to them. And because we're doing this virtually now, IDEA is available in all 50 states. The nuts and bolts of the program. There are 9 visits over 6 weeks with a trained coach who meets with the person with memory loss and the person who helps them. The coaches follow up with participants after the virtual coaching sessions end with 4 monthly phone calls. And then there are 5 assessment interviews done by phone during a 1-year period. And that's where we get the data that tells us whether this intervention is really effective or not. The pair receives $25 for each assessment. So if they do all 5, that's $125. What do the coaches teach? There's 4 primary components to the program. There's problem solving, coaching to identify consistent areas of tension and brainstorm ideas and approaches to improve behavior problems. There's coaching in communication strategies to address challenges related to memory loss and dementia. And then there's a low-level exercise program that includes stretching, flexibility, balance, and endurance to strengthen the body, support independence, reduce injury, and improve mood. And then the 4th component, we address the distinct risks and strengths of LGBTQ+ participants. Coaches also are available as a resource by phone or email. They cultivate ongoing resources and support for the caregiver and assist with connecting to local community resources. And they provide a home safety assessment during the intervention. Even though we're doing this virtually, we have the person with memory loss and their care partner take whatever device they're using and show us different areas in their home. And then we make recommendations as to how they can improve the safety of those areas. Who is eligible for the IDEA program? The person with memory loss and the person who helped them both participate in the study as a pair. Either the person with memory loss or their caregiver must be LGBTQ. Often they both are LGBTQ+, but for the purposes of this study, only one of them needs to be, and they do not need to live together. The person with memory loss must have a diagnosis of dementia or memory loss severe enough to reduce their ability to perform everyday activities. And this is self-reported. We're not confirming this with their healthcare provider. It's totally self-reported. And then the person with memory loss must be 50 years or older. Examples of pairs that we've had in the program: couples, partners, spouses, an adult child caring for an aging parent, a friend helping a friend with memory loss, caseworkers assisting a client. All of these are okay as long as at least one in the pair is LGBTQ+. And because it's a research study, we can't look at the data until we're all done with the study. But we have gotten some great feedback from participants, and I want to read 3 comments that we have received. My partner and I just finished this research project. It's excellent for exercise and also problem solving with someone with dementia in our community. Her dementia has advanced pretty far. It was so good for her and myself, and I think for people in beginning stages too. Our coach was excellent, and we modified the exercises to meet our needs. We'll continue using the problem-solving method we learned and got great ideas for support. Another comment: I feel strongly that Aging with Pride idea made such a difference. I was able to receive what I needed. You gave me new things to consider with support. And this last comment: I love the exercises. Before this program, I couldn't put on my socks. Now I can. So the project is being done out of the University of Washington Schools of Social Work and Nursing. We have community partners all throughout the US. And as I mentioned, IDEA is offered in all 50 states. We have some great outreach resources, and I would be thrilled to pass these on to Kate, and she can pass them on to all of you. We have a website, ageidea.org, and if somebody goes on there, they can even go to an area which allows them to answer some questions. It's a pre-screen to see if they're a good match for the study. We get that information and we can contact them either by phone or email. Very great website that also has a video, a 2-minute video that describes the program. And then we have flyers and postcards, and we're always asking folks to spread these around, hand these out so that we can get them in the hands of as many people as possible so they know about this program. We're on social media. We have ready-made posts if you're interested in any of those. We have Facebook, Twitter, and Instagram posts. And then here's our contact information. We have a dedicated study line, 1-888-655-6646, that is dedicated to the Aging with Pride IDEA study. We have our own website, we have our own email, and then here's my contact information. And Kate has all of that and can provide that to you. And then because we're a research study and I gave you a lot of facts and figures, we always have to reference anything we provide. So these are the references for what I've been talking about.
Thanks again to Amy Cunningham for a great presentation. We also had a very lively Q&A afterwards, which we did not record. Check the video description below for a flyer describing how you can become a part of this important study, as well as a PDF of Amy's slides. Please join us for our next monthly event on September 28th, 2021, when we will be joined by experts from Age Options Advisory Team, who will walk us through Medicare fundamentals and take your questions on all things insurance live on Zoom. This is a great opportunity to have your questions answered by a Medicare expert. Please join us and bring your trickiest quandaries about open enrollment, set-asides, and drug formularies. Login information is at our website, thrivingwithpride.org, and below in the video description. Thanks for watching, and please don't forget to fill out the quick survey below.